Millions of Americans living with depression say they're fine. But new global data shows that for many patients, fine still means lingering symptoms, lowered expectations, and a struggle to put their silent frustrations into words. So Generation Fine is a global awareness campaign from Johnson & Johnson, and it shines a light on a common but rarely discussed experience in depression called settling. Today, I'm joined by Dr. Jessica Jackson, Mental Health America, and Katie Morton, licensed therapist, author, and mental health advocate, to dive deeper into settling. Good morning to you both, ladies. Thank you for joining me.
Good morning.
Okay, so I would like to know, feeling fine, what does that actually look like for people living with depression?
It can look like going through the motions, the day-to-day motions, but not feeling like you enjoy it. For example, you're able to go to work, take care of your loved ones, do things around the house, but it literally feels like you're just doing it. There's no feeling attached to it. There's no maybe joy or even happiness. For many folks, that's where they've kind of settled at when they're experiencing depression, is that might be or feel better than when they couldn't even get out of bed. So they're fine, they're doing okay, but they're not really thriving yet.
Okay, and why are so many patients lowering their expectations over time?
I think people lower their expectations because we can feel like we should be better, I mean, think about it. If you've reached out for care and you saw your provider, you feel like, oh, I should immediately feel all the way better. But maybe we don't. Maybe we're still tired. Maybe we still feel a little foggy or are just not enjoying the things that we used to. And so instead of talking to our providers and saying, hey, I still have some of these symptoms, for a lot of us, we think, I guess this is as good as it gets. And we can lower that baseline for our level of functioning when in reality, we should be speaking up and letting our provider know, hey, I still don't feel great. I want to feel better.
And speaking of, the provider-patient relationship and treatment options, what are some common signs that treatment, may not be working as well as it could or should be?
If you notice that you're only feeling marginally better, for example, if you've started treatment, you started medication, or you started therapy, and you notice, I am able to get out of bed, but it's still really difficult for me to get through the day. Or I'm still engaging with my family, but I don't really enjoy it, right? I'm not getting joy out of it. Or maybe if you notice something like I'm sad still, but I'm just sad less, right? So it's really looking at across the spectrum is how much better am I feeling? Am I getting closer to feeling the way I was before I was diagnosed with depression?
And we know that vulnerability is tough for everyone. So, why is it hard for patients to be vulnerable and say this doesn't feel like enough?
I think it depends on the person, but a lot of the common things that I hear is that we can feel like we're a burden. Like we might not want to tell somebody how we're really doing, especially if it's just a friend or family member. We can feel like, oh, I'm just a downer or I'm bringing them down. We can also, again, going back to what I said earlier, we can feel like I should be better by now, right? We can also have our own assumptions around how treatment should look. And we might even have forgotten, kind of referencing what Dr. Jackson was saying, that like we might not even remember how we used to feel before we got that depression diagnosis. And so we can lose sight of that and think, I guess this is okay. I guess I'm fine.
And for someone watching out there, how can they take that first step, talk to their doctor if they're feeling stuck, and make some headway in their life so they're not just doing fine, they're doing great?
Yeah, I encourage folks to track how they're feeling. Often when we come into an appointment, we almost have a sense of relief or feeling better just because we have the appointment. So we forget how we were feeling last week or 2 days ago. One of the reasons Mental Health America partnered with Johnson & Johnson for this campaign is we'd like to help folks to feel empowered and encouraged to also be in control of your treatment with your provider. It is a true collaboration. And so folks being able to write down how they're feeling so they can come into their appointment feeling prepared.
All right, and where is the best place to go for more information, on this great campaign and, getting people from that fine to feeling better, good, great?
If anyone wants to learn more, go to generation-fine.com. There are tons of resources there, as well as more information about the campaign itself.
All right, ladies, thank you so much for joining me on Unscripted. I appreciate your time.
Thank you.
All right, you guys, more Unscripted on the way right after this. Don't go anywhere.